and when they access medical care, they become a patient. And we want to make sure that the experience that the consumer has as they walk through that is directed to what they need to have to make, hopefully as we go forward, better decisions with you all in how that should work. So some of the practical aspects of that. Many programs are out there trying to help primary care physicians fund some of the expectations that are being put down into the system. So an expectation that we need to increase the amount of care coordination that's going on. Truly, that is one of the known, tested, result-oriented outcomes that around the country you can see where there's been an increase in care coordination. You've seen a stability in the cost structure in those markets and an increase in quality measured by consumer value, whichever way that consumer is saying that they've had a better experience in that process. So is the answer to hire a whole bunch of people back at the health plan, call them up at 7 o'clock at night and say, gee, we want to, I'm a health coach and I want to invest in your time? We haven't seen that really work all that well. We really believe that pushing that decision making and therefore those resources to the closest point of care, i.e. would be your practices, would be the ideal place, is really the way to go. That requires obviously that you'd have enough membership in a certain marketplace, but we believe if everybody did that, that physician practices that are looking to change how they're delivering care, putting team approaches together with primary care and specialists depending on the issues that are involved with that patient, the patient-centered medical home model will go a long way. One of the problems that we've seen when we work at the IPA side is when you partner with a carrier and you say, okay, we want to get paid, some per member per month for our patients because we're a medical home. That doesn't really help you identify who are the patients should those dollars be really focused on. We really believe that those relationships will be better driven if it's identified that these are patients that have a chronic disease that really need additional resources and fund those patients. The reason that we're going down that road, and so that would be a subset of your practice based on severity, it's a severe instance severity adjustment piece. There's two reasons we want to do that. One is that anybody who's been involved in that process, the rosters that you get that you decide whether this is my patient or not are always a contentious issue. We've been doing this with payers for an awful long time. And everybody in this room, from what I heard in this last round of questions, was an awful lot of this. We really think that has to change, or we're not going to get away from that, and we want to be one of the change agents that makes that happen. So we feel that in any given primary care practice, that it's fairly easy to identify your chronic patients, whether that be 5% of your patient population or 30%. It's fairly easy to do based on decent ICD-9 coding. So that it's instantly a severity adjustment piece. We also feel we'll be able to pay on a per member basis a bit more than the $3 that may be out there in different carriers. We'll be able to pay more because we're paying less numbers of patients, but they'll be focused around the patients that really need those services. So that's a first step, a very practical first step, and that will be rolled out over the course of the summer to identify specifically what we're going to be looking for. One of the reasons that we feel it's important for practices to better recognize ICD-9 coding, or is that going to be 10, or are we just going to skip 10 and go to 11, whatever. Couple of reasons. Any of your practices that are involved in a Medicare Advantage plan have already seen this. There's a need from in that case, the payer point of view, to have the best or the most accurate ICD-9 codes available because that is how they generate their revenue from the federal government. One of the pieces that the federal government has